Mhm. And going, sort of piggybacking on this sort of question about the decline in death rates and is the virus less deadly now? In your opinion, was the virus's deadliness overstated or in the beginning, or maybe understated?
Looking back, I would say that if there was anything, the virus was understated in our communities in the US. It was very surprising among clinicians like myself who saw the rampage that it went through in Asia, and saw that in the US we weren't taking it as seriously. Um, when people question whether or not it is deadly and whether or not it is serious and needs to be taken seriously, when I look at the rates of COVID and I look at the mortality and morbidity that we've seen, COVID-19 has killed more people in the U.S. alone in the first 8 months of 2020 than the flu has killed in the last 10 years in the U.S. So when you look at those numbers, you can't discount how deadly, how impactful it is. It has brought our world to a standstill. It has changed fundamentally how we think of ourselves and how we think of our interactions with others. So, if anything, we were very slow to really take into account how serious it is and how important it is to have baseline public health measures in place so that we could be ready for these types of events. Certainly, it was not something that was overstated from the very beginning.